Most people start smoking around age 15, and well, the earlier you start, the harder it is to quit later. Some even experience nicotine exposure in the womb if their mothers smoked during pregnancy. Early nicotine exposure can change how nicotine receptors work in the brain, making addiction more likely. As people continue smoking, they develop tolerance, meaning the body gets used to nicotine, and the initial side effects like headaches or nausea go away. However, even after developing tolerance, taking just a little more nicotine than usual can still lead to toxic effects. Smokers form strong habits tied to nicotine. Over time, everyday activities like driving, eating, or talking on the phone become linked to smoking, making it harder to quit. Nicotine affects brain areas involved in memory, so smokers crave cigarettes during specific moments or emotional states, making quitting even more difficult. Smoking can quickly turn into a compulsive habit. Researchers measure nicotine addiction through tests like the Fagerstrom test, which looks at how many cigarettes a person smokes daily and how soon after waking they light up. Heavier smokers generally have a harder time quitting. Quitting smoking is tough. About 75% of smokers want to quit, and 1/3 try each year, but fewer than 3% succeed without help. Even after serious health problems like heart attacks, more than half of smokers go back to smoking shortly after leaving the hospital. When smokers quit, they experience withdrawal, which includes symptoms like nicotine cravings, irritability, anxiety, difficulty focusing, and increased appetite. These symptoms peak 24 to 48 hours after quitting and gradually fade over weeks, but some, like mild depression, can last for months. Nicotine replacement therapies help reduce withdrawal symptoms, but weight gain of 3 to 4 kilograms, or 6 to 9 pounds, in the first year is common. Nicotine withdrawal activates certain brain systems, causing anxiety and other negative emotions. These brain changes are similar to what happens during withdrawal from alcohol, cocaine, and opioids, contributing to why it's so hard to stay off nicotine. Withdrawal-related stress often leads to relapse. In summary, nicotine addiction is powerful, with deep connections to the brain's memory and emotional systems, making it difficult to break the habit, especially when withdrawal symptoms kick in.